Fibromyalgia. It's really a big diagnosis, catch-all diagnosis, and if you have it, it hurts. Let's talk about fibromyalgia next. Fibromyalgia has been around for a long time, and if you have it, if you've been diagnosed with it, you know it's no joke. And what happens with fibromyalgia is that it's a hypersensitivity of the muscles because of a neurological condition. So we used to think that it was really sensitive muscles, and I'm not even kidding you, it's 10, 12, 14 places along the body that we'll test, and we'll put a direct pressure sensation on these muscles, and we'll calculate how much pressure leads to a pain response. And if we have a hypersensitivity to the pressure pain response axis, in other words, if I push just very little and you're going, oh, and I do that again here, and I do that again here, and I do that again here, and I keep doing this series of pressure pain response tests, and it shows up in multiple areas around the body, that's what fibromyalgia is. And so fibromyalgia for a long time was considered a trash can diagnosis, means that when the doctors couldn't find out what was going on and your pain was kind of over through multiple parts of your body and didn't know how to fix you, it went into the fibromyalgia bucket. Well, more has been done on fibromyalgia since then, and what they're thinking now is that fibromyalgia is actually a dis-ease, if you will. So I hate to use the term disease, but a dis-ease in the neurological process inside the spinal cord and up. So it's not really a problem at the body. Your body feels the pain wherever we push, but it's a neurological issue in the spinal cord area and in the upper central nervous system. So what that means is we have to treat it a little bit different. Now, if you're going to go treat fibromyalgia, you need to see a specialist. This is not something that you just willy-nilly get taken care of because it's a pretty complicated neurological issue. Some neurologists take care of it, some neurological-based chiropractors take care of it, and then you can have some folks like acupuncturists that will do some things to calm the entire nervous system. So it's a complicated but treatable condition, and it has to do a lot not only with whether it be medications or treatments, but also with diet and movement. See, your body needs movement in order for your brain to know what to do to make it work right. And if we're in pain, it makes us not want to move, right? We want to sit down or lay down and get away from movement because movement hurts. But actually, movement within the pain-free zone. So in other words, if it hurts to move my shoulder to here, I should only move it here, but move it a lot. Little movements, getting out for a walk, doing anything that we can do to get that sensory information up to the body, movement, that essential nutrient for the brain, getting that in there is going to allow the brain to then do its part to calm the nervous system down. Because remember, fibromyalgia, it's a central nervous system item. It's not a point where the pain is here from here, it's at here, if that makes sense. Another thing is making sure that you're taking good nutrients and good water. Now, our video is not in the scope of going through all the nutritional aspects of fibromyalgia, but that would be something that you would want to talk to your provider about. Make sure that you're getting good nutrients, proper hydration, and a good enough rest with your movement. And you might need some medication to monitor this as well. So fibromyalgia, there is hope. If you've had fibromyalgia, please know there is treatment for it. People can do great with it, but it is a commitment. It's a commitment to yourself. It's a commitment to health. So if you know of someone who has fibromyalgia or if you're suffering with it, don't give up. Find a provider who specializes in this. If you have any questions, you can feel free to reach out to me directly, jim@ramoslaw.com, and we'll see what we can do to connect you with people who work in this area. So until next time, know that we think you're a rock star and that your health matters.